welcome you to the nursing department of the Hellenic Mediterranean University in Heraklion, Crete, where the clinical nursing simulation unit is installed and operates. The unit, as a part of intraoperative and intensive nursing care laboratory, has 2 rooms: the nursing ward for the students, as you can see on your screen, and the smaller trainers room, which are separated by a window with a single vision mirror glass, so the trainers have a line of sight contact with the nursing ward and monitor the procedure but not be visible to the trainees. This creates a sense of autonomy, reduces stress, and provides the comfort of focusing students purely on the clinical scenario. This is how critical thinking and synthesis of knowledge from many different subject areas and nursing skills are tested. In the trainer's room, the trainer has a full surveillance of the scenario and dynamically shapes it according to the reactions and performances of the trainee. Depending on the actions and decisions of the student, the patient can be deteriorated or his health condition can be improved if he receives the evidence-based care. As you can see, the space is configured according to the requirements each time in a hospital ward or surgery or intensive care unit with the necessary equipment around the patient. There are many devices that can be useful in clinical training, such as nursing care trolley, intensive care monitors, suction devices, 12 channels ECG machine, infusion and feeding pumps, ventilators, and X-ray film viewers. The purpose of the department is to integrate the clinical nursing simulation unit into several teaching units that can be combined with this modern type of education. Simple examples are clinical nursing assessment of the patient, connecting and monitoring patients to the monitor, identifying abnormalities in the electrocardiogram, and listening to breath sounds. It's fully controlled by the trainer's computer with a proprietary software program, and the information is transmitted wirelessly to the nursing ward monitor available to the trainee. As it happens in the hospital, the nurse does have the information in front of him, but the success of the patient care will be determined by the way he analyzes it and how he reacts to the current situation anytime. The software has incredible programming capabilities and requires many hours of training and work before anyone can claim to be proficient with it. You can see here on the teacher's computer screen that it's possible to check the vital signs of all the rhythms and ECG abnormalities. We can determine from where a pulse can be palpated, for example, the pulse to be present in the carotid artery but not in the posterior tibial artery in patients with arterial occlusive disease of the lower extremities caused by atherosclerosis. We can also determine another pulse pressure when the scenario involves hemorrhagic shock. There's a full set of eyes with a pupil in miosis or mydriasis. In other words, there are details that can really help the students' learning, understanding, and clinical preparation before they enter the hospital environment, where they will implement the real and irreplicable clinical exercise. There is also a program with breathing sounds that exceed 10 different really very close to realistic ones. Here's a very good opportunity for nursing training and listening with regular stethoscopes. We have double stethoscopes where together we can listen to sounds and educate our students or have a debate between them. In the field of airway management, the capabilities provided cover a full spectrum of mask ventilation and endotracheal intubation and laryngeal mask insertion. For example, we can ventilate only the right hemithorax or only the lower lobe of the lung, and when listening there is sound only there, while in other labs the respiratory whispering is absent. And the trainees are called at the same time open then certain and managed according to the scenario they have been assigned. The cardiopulmonary resuscitation menu is the most modern application. The simulator has sensors for correct or incorrect execution of chest compressions and inhalations, and obviously we implement the defibrillation step by step. The trainer's PC shows the rate chest compression centimeters for each compression in real time. The patient can be automatically revived on the monitor if everything is done correctly, even without the intervention of the teacher, since we operate on the automatic system and not on the manual module. Also, male and female bladder catheterization module is fully provided with instruments that have sensors and fluid flow valve. It's possible to deal with pneumothorax management based on advanced trauma life support and advanced trauma care for nurses with implementation of the step-by-step process, while the trainee has feedback of successful or unsuccessful intervention with realistic control of sounds, X-rays, since the software program has an electronic database of imaging files that are transferred to the monitor if requested by the learner. Generally, the possibilities in the simulator are much more than what we described now. Debriefing is also very important in simulation training. This is a two-way reflective discussion that promotes critical thinking in nursing. It takes place after the end of the training with the whole crew at the table, and it's about the detailed recording and discussion of all actions, correct and incorrect, with the aim of commenting on the critical points. Depending on the case, we can have a group discussion using the recorded audiovisual material. The aim is to improve the intended result through the systematic evaluation. For closing, I would like to mention that the unit also creates a condition for research work in the field of nursing education, teaching, and documentation. There have already been graded theses that evaluated the educational outcome, satisfaction, and self-confidence of students, for example, when performing aspiration of bronchial secretions from a tracheostomy.